I'm Leslie Hart. I'm the Associate Program Director at Service Inc. of Illinois' Lombard office. So we're going to talk about PUNS today, but also like a general overview of services through the Division of Developmental Disability that we connect people to, and a little bit about our role. So let me change this view. There we go. Okay. So we are the Independent Service Coordination Agency. We're contracted with DHS's Division of Developmental Disabilities to provide interest-free case management services. So we are basically the connection between individuals and guardians seeking or receiving services through the Division of Developmental Disabilities. We facilitate connections with DHS, with service providers. We're kind of like the hub on the wagon wheel. So we have a lot of connections that we make and continued relationships that we have. As administrative case managers, we provide accurate individual information that's used in statewide planning in collaboration with the Division of Developmental Disabilities. So service coordination agencies, there are 11 regions for service coordination in the state of Illinois. And of those 11 regions, there are 7 agencies that provide that service. So our agency, we actually have, I think it's 15 counties that we cover. So we are as far south as like Livingston, Kankakee, Grundy counties, and then as far north as the border with Wisconsin, all the way over to the Mississippi. So our particular service area is DuPage, Kane, and Kendall counties. So what do we do? So first of all, we assist people in enrolling on PUNS and maintaining that information. And PUNS is just a wait list for services. That wait list is individuals are selected from that wait list by DHS, not by our agency. We conduct pre-admission screenings to determine clinical eligibility for services through the Division of Developmental Disabilities, and we provide linkage to service providers. Once someone is actually receiving Medicaid waiver services through the division, we also provide what's called ISSA services, Individual Service and Support Advocacy. So it's a continued relationship with our agency once someone is in waiver services. We develop and monitor the person-centered plan that drives services and addresses outcomes and service quality in collaboration with actual service providers. We are working with them to ensure the health, safety, well-being, and satisfaction of the individual and their loved ones in regards to home and community-based waiver services. We work with individuals and families to make informed decisions, making sure they are exercising their choice and ensuring that they have maximum control over their own lives. We provide housing navigation, which is finding affordable housing for individuals with developmental disabilities who are receiving Medicaid waiver services. We also provide institutional outreach for those individuals living in intermediate care facilities and state-operated developmental centers. So the 2 ways of receiving home and community-based waiver funding is through either selection from the PUNS waitlist for services, or by being in a crisis and meeting DHS's community crisis criteria. So for PUNS, for the PUNS waitlist, it is a wait list for developmental disability services or Medicaid waiver services for children and adults with developmental disabilities who want or need services but do not yet have funding. As funding becomes available, DHS's Division of Developmental Disabilities selects individuals from that wait list from the seeking services category. There are two categories, seeking being one of them. Officially, an individual's wait time on this PUNS wait list begins once they are age 18 and in the seeking services category. Time does not officially accumulate when someone is planning in the planning for services category of PUNS, or technically prior to the age of 18. Selections are now made based on an individual's length of time as an adult, age 18 or older, in the seeking services category. Selections are not made, again, from planning for services category. Now, I will say there's a little caveat to that, to the information I mentioned about those prior to the age of 18. So this last fiscal year and the fiscal year before, there were actually individuals that were younger than 18 that were selected as a part of the youth selection, what they called the youth selection. And these were individuals that were younger than 18 and some a bit older than 18, but still in that transition age. So prior to those two selections, no child had been selected from the PUNS waitlist since I believe it was 2010. So that was quite a long time. So we were very excited that they had those recent selections. We don't know if they will continue year to year or not. So that's why we share the information about wait time officially starting once someone is an adult in the seeking services category. And the best way to be selected, whether someone is a minor or an adult, is to simply be on PUNS and be in that seeking services category. So as far as numbers and some statistics about PUNS, like I mentioned, there's planning for services category and seeking services. As of June 30th of this year, there were 1,789 individuals in the planning for services category, and you can see the divisions of ages there. And then as of March 31st, I'm surprised that's not updated, but as of March 31st of this year, there were 14,486 people in the seeking services category. And you can see the majority of those individuals are 18 or older. Okay, so for PUNS. At the time of enrollment, we will meet face-to-face with the individual guardian to explain services, service options, and how this whole process works. After that enrollment meeting, the PUNS has to be updated annually or as needed. That status on PUNS has to be maintained until someone actually has Medicaid waiver services in place. So at some point, individuals are receive selection letters that indicated they are going to be invited to apply for services. PUNS still has to be maintained until they have an award letter in place. Inclusion on this PUNS waitlist in the PUNS database There is no assumption that anyone is eligible. It is simply, there's no guarantee of services. So there is an official screening process that comes later. An individual just has to present appropriate eligibility, like diagnosis information, to be able to get onto the PUNS waitlist. So as funding becomes available, the Division of Developmental Disability selects individuals from the PUNS waitlist based on their wait time on PUNS. Again, that is wait time officially, that's wait time once someone is in the seeking services category as an adult. Those adult selections are typically happening once every fiscal year. We just had one last month. DHS in the last few years has started completing or sending out letters that we refer to as pre-selection letters, usually in December, to those individuals that they are anticipating selecting in the new fiscal year, typically in July. So those December letters come out, they indicate that DHS anticipates selecting the individual, and then there's about 6 months of time that that individual and their loved ones have to be able to get things in place like Medicaid, gather historical documentation, maybe have discussions about whether they want to pursue services or not. So it's a period of time to prepare for that selection letter. As I mentioned, there have been youth selections the last couple of fiscal years, and we simply don't know how long those will continue. But it's better to be on PUNS than not on PUNS. So the other way to get Medicaid waiver services through the Division of Developmental Disabilities is by meeting crisis criteria as defined by DHS. So we are talking about cases of an individual being homeless, cases of abuse or neglect. Abuse, I mean, it could be the traditional scenario of abuse, but sometimes it's not always as egregious as that. It could be someone that has very serious behavioral concerns that place themselves or their loved ones at risks of very serious harm and injury. Neglect, it's not necessarily, again, egregious neglect. It could be something like a parent who is physically unable to meet the needs of their loved one, thereby putting them in a situation where their safety is at risk. So we have discussions with individuals and families regarding their circumstances and weigh that information to determine whether the situation meets DHS's definition of a crisis. So as far as being able to get these home and community-based waiver services, there's two components. There is financial eligibility as well as clinical eligibility. So as far as financial eligibility, adults must be able to, must have and be able to maintain Medicaid in order to get services. These are Medicaid waiver services. Medicaid dollars are used to pay for these services. For children, we would assist them in applying for Medicaid benefits based on the fact that they have an award letter. So clinical eligibility. So if anyone has seen one of these presentations before, this first item might be a surprise because this is a new change. So for clinical eligibility, intellectual disability is one of the criteria, possibly. and that is an IQ of 70 or below, evidenced prior to age 22. It used to be evidenced prior to age 18. And recently, the Division of Developmental Disabilities changed this in order to meet the federal definition of intellectual disability. So that that age was raised to 22. There are also other diagnoses that could potentially qualify someone for services. Related conditions such as cerebral palsy, epilepsy, autism, traumatic brain injury, or Prader-Willi. And again, these are diagnoses that have to be manifested prior to the age of 22. And if we are talking about a related condition, those particular related conditions have to be severe and chronic and result in substantial functional limitations in at least 3 major life skill areas. So self-care, language learning, mobility, self-direction, and capacity for independent living. Essentially, we're looking at, does that related condition affect the individual in such a manner that they function very similarly to someone who has an intellectual disability? So when we are going through that formal eligibility screening process, and again, that's after selection from PUNS or after having been determined to be in a crisis situation. One of the components of determining clinical eligibility is a psychological evaluation. And this is for individuals who have an intellectual disability. There are particular psychologists that are qualified to complete those evaluations mentioned there. A component of that evaluation is not only the IQ testing, but also a measure of adaptive functioning other than an ICAP evaluation. And the timing as far as completion of a psychological evaluation depends on the functioning level of the individual and the age of the individual. Another component of the screening is completion of an inventory for client and agency planning, or ICAP. And that is done by the service coordinator working with the individual with disabilities. And it assesses adaptive and maladaptive behavior, and it's used to help determine the type and amount of support that is needed for that individual. Medical history and physical examinations are part of this screening process as well, and they are exams that have to be completed by either a physician, advanced practice nurse, or physician's assistant. And they have to address past and current health issues. If an individual has cerebral palsy or epilepsy, there has to be, they have to address those diagnoses specifically. And those assessments have to be current within the last year. For some individuals, there is necessary to have a psychiatric evaluation and a psychosocial assessment. These are for individuals that are on the autism spectrum that do not have an intellectual disability, or for individuals that may or may not have an intellectual disability. They might have another condition, but they have a major mental health diagnosis. So they would be required to have those assessments. There's information about who can complete those assessments. They have to be done within the last 6 months of completion of an eligibility screening. The psychosocial assessment can be completed by the service coordinator, whereas the psychiatric evaluation has specific criteria of who can complete that, as you can see there. So when I was talking about home and community-based waiver services, There's home-based support, and then there's also residential supports. So for the home-based support services program, the intention of that program is to support the individual to remain in their own home or their family home. The idea is to support them in such a way that they can be as independent as possible. And the major component of that program is to provide a monthly allocation of funding to be used to pay for various services. So it's not an amount that comes, it's not a financial benefit in any way. There's no check that comes in the mail. It is simply funding to tap into to pay for services. The monthly allotment for children or for adults that are still in school is currently $1,866 of funding per month. Whereas for those who are adults and no longer in school, the amount is $2,829 per month. Those monthly amounts are typically based on the supplemental security income monthly amount. So for children, it's 2 times that amount. For adults, it's 3 times that amount. In addition to the monthly allocation of money for individuals, there's also an additional $15,000 per year available to potentially tap into to pay for things like home or vehicle modifications, adaptive equipment, assistive technology. And there is a separate application process to be able to use those services or get funding for those services. So this screen and the next screen tells you a little bit about the different services potentially an individual could get with the home-based support program. So along the left-hand side, you'll see various services noted. There's columns indicating whether the service is available in the adult waiver or the children's waiver, whether there needs to be prior approval for that service, and whether it comes out of the monthly budget opposed to the $15,000 budget available every 5 years. So some of the top things that are or most frequently used things on this slide are behavioral counseling, behavior intervention and treatment, community day services for those adults, ISSA services, the individual service and support advocacy, the second to last from the bottom. Everyone gets that. If you are in waiver services, you have to have ISSA services. On this screen, the personal support worker, that's a top service that most people in this program use. Essentially, it's a one-on-one person working with the individual one-on-one. What else? That's the top one on this page. Let's see. Okay, community day services. So for this service, this is for adults that are no longer in school. The idea of the service is to provide a supervised setting and a setting that provides supports the individual so they can develop skills, develop their independence in a vocational environment. Individuals can go anywhere from 1 to 5 days per week, up to 1,200 hours per fiscal year to a community day service program. Supported employment. So this is the concept of having community employment, supporting an individual in a community integrated job. The idea is the individual is going to develop relationships in that setting and have regular interaction with people who do not have disabilities. I will say that with supported employment, It will always begin with the Division of Rehabilitation. So that is another division under the umbrella of Department of Human Services. It will always start there with the Division of Rehabilitation, whether someone has Medicaid waiver services through our division or not. So if anyone has a loved one that is no longer in school that would like community employment, go directly to the Division of Rehabilitation for those services. Do not wait for selection from PUNS. Another service as far as residentially, children's residential. So typically the individuals that are going into these settings are usually individuals in crisis, because DHS is not selecting children and offering them residential services. So there are children's group homes and childcare institutions. Both settings are licensed through DCFS. The children's group home is individuals living together that there are no more than 10 children in that setting, whereas the childcare institution, that is more than 10 children to that setting. And when individuals are living in either setting, they are attending school. The school services are paid for through their local school district, where their family lives, their home school district. And with the childcare institution, typically school is provided on campus, whereas with the children's group home, individuals are going to school locally in that area where they are living. Adult residential. So community integrated living arrangements. So if you've heard a lot of people talking about group homes, this is typically what they're talking about, or SILAs, community integrated living arrangements, SILA. You'll hear that term a lot. So the supports in a SILA setting can be anywhere from 15 hours of support per week to up to 24 hours per day. So the traditional group home setting, that is a 24-hour supervised setting for individuals. Usually 4 to 6 people are living together in one of those settings. They can go up to 8 people. And I will say there is a little bit of a push from DHS to reduce those the number of individuals living in their setting. There's a bit of a push to get that to 3 as well. For individuals that don't need that level of supervision of 24 hours a day, there may be individuals that perhaps are living in their own apartment or an apartment with roommates, and they can be quite independent in a lot of ways. They don't need their staff there overnight, perhaps. Maybe they need some supports for some higher level skills, maybe making doctor's appointments, going to doctor's appointments, paying bills, budgeting their money, things like that, whatever the needs are of that individual. But maybe they don't need that 24 hours a day. So maybe it looks more like 15 hours or 25 hours of support per week, depending on the individual. Whichever setting this is, the whole idea, again, is to provide supports to the individual to be as independent as possible. And their services are person-centered. So it is dependent on the individual's needs and their desired services. Another residential setting that you don't hear a lot about is community living facilities, or CLFs. So most of these settings were changed over to SILAs years and years ago, like in the late 90s. There are still a minimal number of these settings left in Illinois. I think there are 9 in the state of Illinois still. Same concept of 24-hour supervision. These are settings where there's no more than 16 people with developmental disabilities living together. Again, it's the same concept of trying to provide as much support and guidance and supervision to make sure the individual is as independent as possible. Individuals living in these settings must be involved in some type of vocational program, whether it's like a day program or employment in the community, vocational training. They have to be involved in something. So when someone is involved in any one of those programs that we're talking about, there is a component of person-centered planning. So our agency helps develop a person-centered plan that addresses the individual's strengths, preferences, needs, and desired outcomes. Individuals typically are involved in that process along with guardians or any other individuals that the individual or guardian would like to be a part of that process. So there's a lot of discussions about the needs and desired outcomes for that individual. The plan itself takes into account a lot of different aspects of an individual's life, including risk factors, including health, safety, overall life goals for that individual. It lays out what kind of services that individual needs to be as independent and as successful as possible. Our agency helps the individual or family locate and select provider agencies that are willing to provide those services to address the needs of the individual. And the person-centered planning or the person-centered plan provides the details in the plans that the provider agency can then focus on. And in their plan, which is called the implementation strategy, they talk about how they're going to address the needs that are mentioned in the person-centered plan, and what their plan for working with the individual is. So, you know what, I'm gonna jump forward. Oh, okay. The one thing missing off of this is once someone is in those services, like I had mentioned before, we do have ISA services, and that is that long-term relationship. So we will continue to work with that individual that is receiving Medicaid waiver services. Our ISA service coordinators will do quarterly visits, and they will update that personal plan that we talked about. They will update that every year and continue to work with the individual with potential providers. So again, it's a long-term relationship with our agency. Other service options. So if someone is on PUNS, not receiving services yet, there's other things to think about and possibly use in the meantime. So there is in-home respite, out-of-home respite services. These are grant programs that could be found through provider agencies. There's also, and it essentially usually provides the funding to be able for family to be able to hire their own worker to give them respite. There are a few agencies that provide out-of-home respite for adults in the state of Illinois. They're not a lot, but they are out there. So that's potentially there. And then there is the supported living program. That's a program for individuals. It's traditionally for individuals with physical disabilities, but we've had a number of folks that choose to move to those settings. It's individuals who have disabilities that are age 22 or older, or elderly individuals age 65 or older, who need some long-term supports. Essentially, it is individuals have their own apartment. There's staff on site to assist with various needs. And that is not through the Division of Developmental Disabilities. That is separate from our services, but it's something to know about. And then ICFDDs, or intermediate care facilities. These are residential settings with 24-hour supervision for individuals with developmental disabilities. And 3 or more people live in those settings. Typical size of an intermediate care facility is 16 people. They are smaller, and they are much larger as well. It just depends on the particular facility. For that type of setting, if someone was an adult who wanted to live in one of those settings, they would have to go through an eligibility screening process, like I talked about before. They would also have to have Medicaid. And our agency potentially could assist with finding that type of setting for an individual. So things to do before high school or transition school ends, making sure someone is on the PUNS waitlist for services in the seeking services category so they can accumulate wait time on PUNS. For those that are 18 or older, applying for supplemental security income and then applying for Medicaid. Also, as I had mentioned before, when we were talking about supported employment, if someone is looking to have a job in the community, you can contact the Division of Rehabilitation for those job support services. They also have a home services program for those individuals that need assistance in their home. And then also keep in mind, special recreation groups in the area often have day programs or various programs that an individual can get involved in. There's also a lot of other agencies out there that will accept private pay for services too, if someone is out of school and they need activities to get involved in. And just a tip to please save all the individual's assessments, evaluations, and school records. They are important for a variety of reasons. We look for that history as a part of our screening process. We're looking for the proof of those disabilities within those timeframes I talked about prior to age of 22. Also, if you're applying for social SSI or supplemental security income, they are going to be asking for records as well. So always keep those. And then just some commonly used acronyms, because we recognize that we talk using a lot of different acronyms that you may not be familiar with. So we kind of gave a little cheat sheet for you guys too. And then also here's some resource links that we just find helpful. So the Division of Developmental Disabilities, they have a lot of information on their website. Information about the home and community-based services waiver, the consumer handbook for home-based services. That's really helpful. You know, when I was going through those charts of possible services, those charts are in that handbook. There's a lot more information as well. The Arc of Illinois is a good resource of information too. And then iPad Unite is a good resource. It's a parents program that there's a lot of sharing of good information on that site. And I think that, yep, okay. So my contact information there is at the bottom, and my program director, Rebecca, her information is there as well.